Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people to find answers for chronic health issues, chronic health problems. All right, well, I want to dive right in with today's topic, kind of some interesting information here. Now, we had done a past video on how blood sugar affects hormones in men, but now we want to go on to how blood sugar issues can affect hormones in women. So when I say blood sugar issues, this can be diabetes, pre-diabetes, hypoglycemia. I mean, the thing is you could have high blood sugar, you can have low blood sugar, you could have a roller coaster in blood sugar called dysglycemia. Any of these factors can be problems. And again, to find out more about diabetes, look at some of our other videos, and more about blood sugar issues, look at our other videos. But here's the thing is, if you're a woman, especially a menstruating woman, then this information may be more for you. Although, if you're not menstruating, if you're menopausal, perimenopausal, this will still apply. Actually, it will apply completely. So, all right. So let's dive right in here. Okay. So insulin surges in women, sometimes this is called polycystic ovarian syndrome. Now, in order to have polycystic ovarian syndrome, you don't have to have cysts on your ovaries. You can just have the symptoms of this. Now, what would be the symptoms of this? So here's what happens. Basically, let's start off here. Basically, you start off with just one second here. With high blood sugar. All right. So if that blood sugar is high, this is a problem in itself. This is going to cause all kinds of issues. Now, I would say, again, this doesn't just have to be high blood sugar. This could be fluctuations in blood sugar. Your blood sugar could also drop low and then spike high when you eat. And that's what happens a lot with low blood sugar or hypoglycemia, is people's blood sugar will drop really low, but then they eat something to bring it back up, and then they get this surge, this tidal wave of insulin, and this can start to propel into insulin resistance, pre-diabetes, diabetes, and issues like that also. Because what happens when we get high blood sugar? We get insulin surges. We can call them insulin tidal waves even. So, and insulin surges doesn't have to mean that you have diabetes. If you really haven't been diagnosed with any type of blood sugar problem, and let's say you ate a big meal and you felt tired after that meal, or you ate a big meal and you're like, gosh, I just ate that great dinner, but I need something sweet now. I just wish I had a sweet. Yeah, these are signs of insulin resistance. These are signs that you've had insulin surges. If you're a person who's had low blood sugar, where again, you get shaky, you get irritable, and then you eat, and what's going to happen is you're going to get these insulin surges. So any of these factors can cause insulin surges. So when we get these insulin surges, basically, in fact, let me just high insulin. All right. And one of the things, like I was saying, what can happen to increase this? We'll just call it functional hypoglycemia. I just don't want to leave that out, because a lot of times we just think high blood sugar when we think of insulin surges or diabetes or things like that. So, yikes. Okay, we get high insulin with these types of issues. Now, what happens when you get high insulin? First thing that happens in women is there's an enzyme in your ovaries that gets activated. So let's do this. Let's say ovarian activation. And then actually this enzyme is called 1720 lyase. You don't really have to remember that. And actually, if you don't have ovaries, you can even get another enzyme affecting you. And this one is called aromatase. Yikes. So either of these can be a factor. Now, once you activate that, that enzyme, especially the 1720 lyase, what happens? Well, basically you get an increase in the production of DHEA, and not really the production, the conversion of testosterone. All right, so both of these will increase. Okay, so what happens here is your body starts to convert your estrogen into testosterone. And then you get increased DHEA levels, and DHEA is another hormone that turns into testosterone. Actually, DHEA turns into estrogen and testosterone, and it's made by the adrenal glands, but it'll be more converted into testosterone. So now all of a sudden, because of these insulin surges, you are a woman getting increased testosterone levels into your system. And testosterone in itself will increase insulin. So doesn't really help, or let's put it this way, testosterone, I should say that, I need to correct myself here, and I don't know why that's coming up. It increases insulin resistance. So what happens if we increase insulin resistance? I don't know why that pops up. Then we get increased insulin production, and then the whole thing just cycles around over and over and over. So what can happen to you? What does this mean to you? Well, one thing that can occur is in women, you can get increased facial hair growth. You can start to testosterone in women. The frontal lobes of a woman's brain needs estrogen to give you drive and motivation. So this could do just the opposite. It could lower your drive and motivation. It could also make you feel more irritable, more aggressive. It can cause even male pattern baldness. There's so many negative factors here. And also, if you have high blood sugar, you're usually gaining weight. And in women, weight gain will usually occur on the sides of their body or the hips, whereas in men, because their primary hormone's testosterone, weight gain usually occurs in the belly, in the front of the stomach. Now, what will happen in women who have this going on, they'll start to gain weight in that belly area rather than in the hips and the flank area. So again, this can all shift a lot of things around, and it's just not a good thing. Now, another thing that can occur too with this malfunction is eventually you can get ovarian cysts. Which can be pretty painful. Also, increased testosterone will increase potential for acne and things like that. So definitely not what we want to see or have because of the symptoms and because of what it can do to a female, especially, let's say, a growing female. If this is occurring to you and you're a teenager or in your 20s as a female, yeah, this could set the stage for a lot of future problems. If you're older than that and you're starting to get these symptoms, yeah, the thing is when you have all this going on, you've got to, look at your hormones. The doctors are going to say, oh, we need to look at your hormones. Well, yeah, but really, you need to look at the blood sugar. This is a blood sugar issue. A high percentage of hormone issues that occur, female hormone issues, even male hormone issues are due to blood sugar issues. So the thing is to find out, number one, why do I have a blood sugar issue? Is my diet horrible? Am I eating incorrectly? Or is my diet great, but I'm not absorbing what I eat properly, except for the sugars and carbs, which usually entails issues with gut inflammation and things like that. So there's a whole cascade of potential causes to these blood sugar issues. It's not always what you're eating or not eating, but that can also many times be an issue. All right, well, I hope this gave everybody some great information. And again, you want to find out the cause of these, especially if you already have chronic health issues, chronic health conditions, autoimmune issues. You want to dig deeper and find out causes, and not just deal with symptoms. I mean, because again, you could add in some estrogen or progesterone or things like that, but is that really helping the cause of the problem? Okay. Well, I hope everybody enjoyed today, and have a wonderful day, and God bless. And I will see you next time.